Cerebellar myelination. Typically, when do you see? If you get the same question in APPG, what will you do? You will leave this question. You will not attempt to answer this question. You are bound to lose this question. Very pessimistic teaching this is called as. So 1 month is what you need to basically remember. Route of mesentery. This is a repeat question basically. Right ureter, IVC, abdominal aorta, right psoas, they are all the various structures that route of mesentery is crossed by is what need to be remembered. Very happy to see our Secunderabad students and 61 plus online viewers and another 200 plus students across various centers in the country. Now doctor, let me shoot you a quiz question. Please shoot me an answer. Which visceral artery is most commonly affected by aneurysm? You like to say? Splenic artery. Excellent. Now the superficial branch of the ulnar supplies palmaris brevis is what you need to basically remember. So you must know what are all the motor branches, sensory supply, thenar muscle, especially adductor pollicis, which is tested by the book test. It is by the ulnar nerve, and also the palmar interossei, dorsal interossei, etc., etc. Now I want to ask you a quiz question. Come on, doctor. Sensory supply to the skin on the dorsum of the hand along with the digits. Somebody said median, median, median or radial. Huh? Let our online students also punch and share the joy. Yeah. Srinivas, Chaitanya, Prabha, everybody is saying radial. Absolutely. Closing the jaw typically is the function of which important muscle? Middle pterygoid, temporalis, masseter, all of them are involved. You take previous AIMS, All India, PGI, JIPMER, DNB, CET, any exam, pterygoids and the function of the jaw muscles, very high yielding topic is what need to be remembered. So, the opening of the jaw is by the inferior head of the lateral pterygoid, anterior digastric, mylohyoid. So, there is a reason mylohyoid comes not in closing of the jaw. Masseter and the anterior middle temporalis, medial pterygoid, superior head of the lateral pterygoid. You should remember for the closing of the jaw is what I want to underscore to all of you. Chalo. One quiz question. Shoot me an answer. Which muscle depresses and protrudes the mandible? Lateral or medial? Lateral pterygoid. Let us see our online students, what do they say for the same? Very good. Lateral or medial pterygoid? Kaleem is absolutely wrong. I am waiting for that. At least one student should encourage me, no, by giving wrong answer. So, lateral pterygoid is the one which is, as all of you said. Hardest substance of the teeth is basically dentin or cementum? Dentin. Enamel, no? Ha, that's right. This is spelling, I mean key mistake. Huh? Alright. Simple diffusion means what? Simple diffusion means love marriage, no dowry, no ATP. Right? So, ATP usage is not a part. Hypoproteinemia. What is the effect of it is important. So, what factors affect the GFR? The changes in the renal plasma flow and afferent and efferent arteriolar constriction and dilatation, changes in the concentration of the proteins, etc., etc. Now, how will you calculate renal plasma flow? Effective renal plasma flow. Classically, it is MAC3, which is called technetium 99 labeled mercaptoacetyl triglycine is the one. Similarly, inulin is asked, para-aminohippurate is asked. Intracellular, extracellular fluids is the high yield topic, which you should recognize. If you did this wrong, you should read the topic thoroughly. After exercise, why the neutrophils increase in number? Exercise will cause the stimulation of sympathetic system, and epinephrine has an effect of demarginating the neutrophils from the vascular endothelium is what you need to remember. What will myelination will do? Myelination increases the speed. It has nothing to do with anterograde axoplasmic flow. All the remaining things basically are due to myelination. One question on ODC. Without that, how it is called entrance exam? Left shift, right shift, increased affinity, decreased affinity, 2-3 dBg high, 2-3 dBg low. You must be quite sure. Whenever there is a decreased pH, whenever there is an acidosis, there should be more delivery of oxygen, and decreased affinity is what you have to fundamentally remember. Then what lead to gout and hyperuricemia? All this will lead to, but not xanthine oxidase deficiency. We use allopurinol to lead to decreased uric acid production, whereas PRPP synthase, glucose 6-phosphatase, 5-phosphoribosylamidotransferase, they are the three important enzymes whose deficiency lead to the development of hyperuricemia, and gout is what you need to remember. Now comes the quiz question. So every mock test we will ask you on urea cycle, purine pyrimidine metabolism, one question on porphyrin. 25 mock test लिखने के बाद भी if you don't become 007 James Bond and go to the exam hall, we are disappointed. So you have to read if you have done wrong. Urea cycle is most ignored topic in MBBS undergraduation. Biochemistry itself is one of the, we finish it like a formality quickly, 2-3 months mein we finish biochemistry. Which step consumes ATP out of all these steps? Kaun bolega answer? I am getting an answer. Kaleem boldly is saying first step. Carbonyl phosphate formation you require consumes ATP. Khalil also is very much tempted by that seductive option. Kiran is proposing cleavage of arginine as much as our friend who is also thinking the same. Yeah. There are 5, if I give you after second, it's like playing rummy. If you finish by the time third round is over or second round is over, then everybody will get big points. 20 rounds खेलने के बाद, if the game is closed, everybody will get only 2 points or 3 points. So synthesis of arginosuccinate. पत्ते खेल रहे या नहीं खेल रहे? अरे should play rummy, watch movies, have a booze, have a disco, still prepare. That should be the way you should celebrate, not wait for that फांसी के लिए जैसे हम प्रतीक्षा कर रहे, मार्च कब आएगा, कब सर को फांसी में लगाएंगे, वैसे नहीं वेट करना. Enjoy the life like any other day. Entrance is also like any other day. So synthesis of arginosuccinate. Corticosteroids typically will cause all these things, but they don't inhibit the immunoglobulin destruction. They increase glucose formation. That's the reason somebody has ITP. You started steroid. Somebody had nephrotic syndrome. You started steroid. They will end up to show diabetes because the glucose intolerance that will happen. After fasting for 24 hours, easiest question, fatty acid synthesis nahi hoga, remaining things hoga, gluconeogenesis, lipolysis, etc., etc. Then cyclic GMP, once more you can recognize, secondary messengers is a very high yielding topic. So nitrous oxide, BNP, ANP, all of them use the cyclic GMP as the secondary messenger. is what you have to basically remember. Then about the culture media, what is accept about it? Chocolate agar is not anaerobic medium. There are some special media which are called anaerobic media. Robertson cooked meat, thioglycolate broth, Smith-Nagoshi medium, etc. etc. Now one quiz question. E. coli produce green metallic sheen on which culture medium? Shoot me an answer, doctor. Raj, Nagesh, Shweta, Kiran should punch an answer. Yeah. E. coli produce boarded gangol. D. Sorbitol, McConkey you want to say. Any other? Boarded gangol. Or yeah. Raj and Khalim is proposing charcoal yeast agar. Before the end of this paper discussion, at least one time Khalil, if he answers correctly, मुझे स्वर्ग के द्वार खोल जाएगा. So good, I am happy. He is answering. You should answer. If you answer in a group, when you go wrong, you will remember it longer, right? So eosin methylene blue, it is a enteric gram negative rod detection के लिए use करते हैं इसको. E. coli green metallic sheen will be there, is what you need to remember. MHC class 2, where is it typically present? So typically on the dendritic cell. Another variation of this question can be HLA B27 belong to which class of MHC? Class 1 में ABC है, right? Then class 1 is found on any nucleated cell. That is what you need to remember. Similarly, graft rejection होता ना? Why do you do HLA ABC matching? Because it is a class 1 which is involved in the graft rejection. Then hormone receptors are which type of MHC class? They are basically class 1. They are the important things to remember. Then class 2, they are more restricted in their distribution. And they are found on the antigen presenting cells like the dendritic cells is what you need to basically remember. So that is the reason, doctor, MHC2 is present on the dendritic cells. Then another thing, T cells do not produce MHC2, do not possess, but activated T cells possess the MHC class 2. Coming to the NK cells, what is their speciality? Their cytotoxicity is not antibody dependent or MHC restricted. Right? So, NK cell activity doesn't require prior sensitization. Generally, we have two types, no, cell-mediated immunity, humoral immunity. Humoral means antibody, cell means cell. But both the abilities किसको है? NK cells को है. So that is the speciality of NK cells. Northern blot is basically RNA, South India is all DNA, and Westerners eat a lot of chicken and mutton, so protein is Western blot. Chalo, shoot me an answer. Quiz question. Selective medium for Legionella species. Microbiology smells. Buffered charcoal yeast extract अगर our seniors are second division में है, हम पहले division में हैं, huh? So good. I am happy to know that last moment आ रहे हैं बोले तो January में ऐसे tickle करे तो ऐसे voluminous response आना. That should be your ultimate objective. Okay, doctor. So remember, boarded Jengo is enriched medium. Bordetella purchases. Sorbitol, McConkey differentiates, selects for the E. coli. Buffered charcoal yeast extract agar is Legionella, is what you need to basically remember. There are totally, Shweta rightly said buffered. Khalil should answer. I am waiting for it. And Raj is saying BCYE. Very good, doctor. Very good. MRSA. We use the pulsed gel field electrophoresis in order to do the typing, which is true. MRSA is not only resistant to penicillin, but to any other beta-lactam antibiotics, including the cephalosporins and carbapenems, is what need to be remembered. We use vancomycin as a treatment of choice. Suppose if there is any mild superficial infection with MRSA detected, you don't need to give any systemic vancomycin, but bezitracin, mupirocin, they are sufficient is what you need to basically remember. What is a aerogenic Shigella? Burping Shigella. Typically Shigella flexneri type 6. There is one more disgusting question like this. In pneumococcus, but type what is most dangerous type? 1, 2, 3 or what? Homework. Huh? What is the meaning of homework? Teacher also forgot exactly. So that's the reason. But issue वहाँ है. Issue pneumococcus में which type is most dangerous? Type 1, 2, 3 में कुछ है. जरा देख लो. हाँ. Then doctor, proton pump inhibitor. And what is the effect of it on antiplatelet activity basically? So clopidogrel concomitantly, if it is given along with the PPI, then it will produce a reduction in the inhibitory effect of the clopidogrel. Clopidogrel काम नहीं करे तो clot होगा, clot होने से coronary artery disease होगा, coronary artery disease से heart attack होगा. किसके वजह से? PPI के वजह से. Your elderly patients को सब देते ना? You will get when in the MD general medicine practice, there are some drugs your patients know better than you. Suppose if you prescribe them, they will say, अरे इनके पास जाके इतना लंबा क्यों में बैठ के ये ड्रग के लिए है क्या बोलते? For example, clavum. Even grandma also knows BID or TID, right? Then she knows to take Allegra, fexofenadine. She knows to take proton pump inhibitor. She wants to come for something above that. Will you give something above that? Any newer congener can you give? Like old JIPMER MCQs, if you give it in a mock test, she will say, oh, I do know that he is going to give this only. I told you before going only, no, she will tell. So that is what you need to remember. PPI and clopidogrel. What impairs GI motility? Erythromycin is the macrolide. It acts on motilin receptors and post-operatively it will promote, it is used to promote peristalsis and it can speed the gastric emptying is what need to be basically remembered. Huh? Verapamil is there which can lead to constipation. Which of the following impairs was there? Impairs can be stimulate or inhibit. I think the word stimulate must be used. That was actually the original MCQ in JIPMER 2013. Recall bias. What is the drug which is used in both types of diabetes? 2014 ka February, March paper we have seen, November paper we have seen, abhi 2013. All three exams, what is the common question? Diabetic drugs. Okay. So this Friday, don't forget, please do come. We will have PGI May 2013 paper discussion. Okay, we will give you question paper without explanations, only question paper to your hand, so that last time you were little feeling sleepy in the class. Without anything in hand, the mind will be flowing somewhere with thought process. So that's the reason we will give you the question paper when you come. So please do come for a free session on Friday, PGI May 2013 paper. So what is the drug which is used in both? basically we use pramlintide. So pramlintide is a analog of amylin, and typically it is absent in the people who are type 1 diabetic and reduced in the people who are type 2. So ethanol, why do you use it in ethylene glycol poisoning? Ethanol acts like a competitive antagonist. Competitive antagonist for the alcohol dehydrogenase. That is the reason we basically use it. Similarly, fomepizole is also another alcohol dehydrogenase inhibitor which is commonly used. What is wrong about cocaine? Cocaine ke half-life ke upar examiner is testing your knowledge is too much. T-half is about 30 to 90 minutes. I say numerical based questions hai to better, if by elimination you can do that, fine. If you are unsure, better leave it in a negative marks exam. Courier-like effect. So basically clindamycin can inhibit the neuromuscular transmission. Aminoglycosides are also having a ability to prolong the neuromuscular blocking effect is what I want to underscore to all of you. Then let me ask you a quiz question, doctor. Yeah, Prabha is asking, sir, what about us? We will upload in newsformedico.com beforehand only the PGI May 2013 PDF, which you can open it up and can be able to review. What is your answer? Anticholinergic group of Parkinson. I think now you are all talwar ke tar ke jaise jawab de rahe. That should be the spirit. Trihexyphenidyl benzotropine, etc., etc. Caspases. If apoptosis is in the option, what is the answer? Apoptosis is what need to be remembered. And you have seen 2014 November, 2014 March, 2013 March, सब जगह एपोटोसिस होता है. एपोटोसिस के बिना पेपर नहीं होगा. So it is not a cause of CRF. If you take PSGN, post-typical glomerulonephritis, two peculiar things commonly asked in entrance. Will there be hypocomplementemia in PSGN? It will be there. But by third week, it is supposed to normalize. If it doesn't normalize, it is against the diagnosis of PSGN. Similarly, PSGN does not end into chronic renal failure. In pediatrics, you might have seen lot of patients with PSGN. Pediatrics ward, smoky colored urine, etc. But only 10% will progress to renal failure within 10 years, and no more than 40% develop the renal insufficiency is the point which you need to appreciate. What type of reaction is type 2 lepra? So you must know the relation 1 plus 4 is equal to 5. Type 4 is type 4 hypersensitivity, type 2 is type 3 immune complex mediated hypersensitivity. कभी भी दोनों को मिलाए तो 5 निकलेगा. See my chromosome 8 is Burkitt's lymphoma. Another very standard promising topic. Know the oncogenes and shoot your answer. So doctor, Burkitt's lymphoma, CD19, CD20, CD10 and BCL or BCL6 is what you need to basically remember. Then maximum storage time कितना दिन रख सकते? 5 days, 20 to 24 degrees Celsius. Platelets एक मर्तबा देने के बाद platelet count increases how much for each PRP? 1 PRP packet को दिए तो 10,000 is the expected rise of the platelet count. But the platelets that you give will have a half-life of only 1 day. That's the reason ITP patient में 30,000, 40,000, 50,000 देख के आप उनको platelets देना शुरू मत नहीं करना. There is no need for every thrombocytopenic patient to give platelets. In fact, in ITP, idiopathic thrombocytopenic purpura, if you give platelets, that will further stimulate autoimmunity and can worsen it. So that is the reason, unless platelet count is critical or bleeding diathesis is shown, then only you need to give sparingly the platelet transfusions in case of ITP. Come on, doctor. Which is called initiator caspase that activate other caspases. What is that golden number? 8 and 9, 9, 3, 8 and 9 or only 9? Yeah. Yeah, please shoot your answer. Shweta is proposing 6. Some new thought process. Please give big clap for those people who said 9. Loud clap for you to remember. Caspase 9 is what you need to basically remember. Saccular aneurysm are those which involve only a portion of the vessel wall. Obstructive sleep apnea may alveolar hypoxia will be there, pulmonary hypertension will be there, that will put pressure. किसके ऊपर वजन गिरेगा? Right ventricle के ऊपर, और right ventricular failure होगा, left नहीं होगा. That's what you need to understand. An infant, yeah. Then I'll come to all questions, don't worry. I mean, first we will finish one particular entrance, whatever that questions we have. Are you happy with the old questions or you don't want? If I give complicated questions in a mock test and unnecessarily bring down your scores, this evening is a displeasure for you, for me, everybody. Actual entrance also 50-60 questions only are tight questions. 110 are 150 are 40 are easy questions. Easy questions. If majority of you are crossing 150 score, then I will make it tough. That's what I am thinking. Suppose, no sir, we will have all original questions like our earlier papers. Then you won't cross 100. Right? So, and unnecessarily you will be weeping for nothing. So, my job is not a scary teacher. Okay, we will 1 week vaisa, 1 week aisa. So that you will become sthitati munivruhyati. That is, in spite of elation or depression, you maintain equanimity of thought. So, we will try to create that in you. An infant presents with cardiac failure, weak femoral pulse compared to radial pulse. What is your answer? Aortoradial delay, radiofemoral delay. If it is there, then it is coarctation. Typically, high risk newborns, diarrhea is a cause, typically not in the neonatal, but under 5 mortality is what need to be remembered. Non-immune is not RH incompatibility. RH incompatibility is an immune hydrops fetalis. Total body irradiation typically is used for bone marrow transplantation is what need to be remembered. Now some of you are going to be top oncologist doctor. Should be an answer. A patient is posted for BMT. BMT करने के पहले, before marriage, what will be there? Gauri Vratam will be there, Vara Puja will be there. I mean, in Hindu marriage. Then there will be ring exchange. बहुत कुछ होते हैं. Ultimately, आप कबूल बोने के पहले. So similarly, BMT also, before you induce the transplantation, some things are done at some period of time. So, on which day before transplantation chemotherapy is basically given in preparing a BMT patient? Who will give the correct answer? Shweta Raj is proposing 10. Kaleem's golden number is 14. And Raghav is saying 7. आपका नंबर क्या है? फटाफट 5. T10 is 10 days before transplantation शुरू होता है डॉक्टर स्टोरी. 5 to 7 you will give aggressive chemotherapy. Who said 7 or 5? Online. 7 or 5. Raghav gets a big clap. Very good. Please give a one big clap. Big clap, big clap. Ah, that's good. Then T2 to T4, patient is given total body irradiation. T2, stop doing anything. Just like before entrance exam, 48 hours before, what will you do? If you have a fiancé, you can put your head and cry on his or her shoulder, so that do din mein फांसी का दिन hai. So actually it won't be like that. If you are getting seat means you should get a good sleep for tomorrow's exam. Take it as an indication. If you are getting seat means you should be ready to do a night duty today and still go to the exam fresh tomorrow morning. Right? There is nothing in the last 48, 72 hours में क्या करना, भजन करना, कुछ भी नहीं है. जो करना है अभी करना. आगे अभी अगर भजन नहीं करे तो उस वक्त भगवान आएगा नहीं. तो that's the reason you need to be sure. Tinea versicolor, what is except? So it is not the greasepril win, ketoconazole, itraconazole, fluconazole, selenium sulfide shampoo, etc. etc. Wood lamp, what was there? Wood lamp? Orange नहीं होगा क्या? Golden yellow मिलके orange नहीं होता क्या? I'll check the option ये. मैं उसको देखा भी नहीं था. Okay. Daycare surgery, propofol, cheapest question. Then, this is most unwanted question. Dose ratio of adrenaline to lidocaine. Right? So 1:2 lakh or 20,000, 2,000, 200 आपका rank दिख रहा है. Which one you want to choose? If you choose 1:200, your rank will become 1:2 lakh. So correct answer is 1:2 lakh. Then intracranial tension typically is increased by ketamine. Then etomidate is steroid synthesis inhibitor. Another routine question. Xenon cannot be metabolized not only in your body, in the nature also, inert gas. Then snowstorm is basically hydridiform mole. So at least be hopeful. Maybe in this June one more JIPMER is supposed to be there. Is it there? Yes. If it is there means at least be ready for getting over there. And let me tell you, our one of very favorite students, all students are favorite for us, Nafis, she got in gynops in JIPMER, but she was completely clean bowled in APPG. 200 rank आ गया, वहाँ पूरा nation को मिला के she got in the top 100. So that is the reason there is complete no relationship between your one institute performance and the other institute performance. Okay, doctor? So last exam में मेरा rank 5000 आ गया AIMS में, या नहीं तो all my friends at least got 50 marks, I got minus 50 marks. So अगर आप ऐसा हो तो भी there is a good prognosis possible in the forthcoming state entrance. That's the point. Then doctor, bamboo spine, typically ankylosing spondylitis. So why that thing happens? One entrance में अच्छा rank आके दूसरे बुरा rank आके दूसरे में अच्छा क्यों आएगा? Because any rank's ultimate performance decided by proportion of new questions versus old questions. As we know, cytological dissociation, if it is there, right? Old questions are 80% questions are old and only 10-20 are new. बोले तो you may be good student but you may be clean bowled, because the veterans in the entrance preparation will completely sweep you off. Suppose more questions are new where common sense should be used and only less proportion are there means, then that is a different kind of talent show, right? So that is the reason one entrance, other entrance, but there are few exceptions. There are students who Everywhere they go, they get the top 10 ranks. That is, they reached above the level of insanity, below the level of humanity. वो लेवल को पहुंच गए हो, वेदांता के बाद उपनिषद को भी खत्म कर दिया उसने, वेदास के बाद. So inferior dislocation is axillary nerve. Anterior dislocation का mechanism क्या है? Interesting question. Basically, this is how the anterior dislocation, abduction and external rotation. Whereas what is the mechanism if you are having a posterior dislocation like this? Medial rotation, adduction is a mechanism for posterior dislocation. Posterior dislocation only happen whenever there are seizures or electroconvulsive therapy. Most common is basically anterior dislocation is what need to be remembered. Sippert's cards sign. This is purely JIPMERogenic tumor. So JIPMERogenic fact. No other entrance they will ask, and if at all they ask, they will ask once more in JIPMER. So what is Sippert cards sign? Once more, INICET questions को भी क्या, what are you going to do in a negative mark exam? छोड़ दो, कोई कुछ नहीं होगा. Don't be tempted. I know Pertis, I know Blount, I know Shrewman. Earlier when the state is very big, everybody know only one man, that is Chief Minister. But once it became Telangana, Andhra, everybody knows other. Everybody is other's relative only, one or other way, udhar milaye to. है ना? हाँ, तो all look very familiar to you like a small state ministry. But result is basically Blount's disease may, there is a, what is Sippert card sign? Let us talk about it. In the extension, knee is stable, but if you do 20-degree flexion, the medial femoral condyle will subluxate into the posteromedial depressed tibial plateau, which is demonstrated by flexing the knee, which is then called Sippert card sign, is what need to be remembered. So where do you see gun stock deformity of the supracondylar fracture? If that is there in the options, that is what examiner want you to answer.